NLN Pre-Nursing Entrance Exam Quiz. Question 1. Which sum equals 3/8 plus 1/8 in this fraction item? Option A, 3/8. Option B, 1/2. Option C, 1/2, 1. Option D, 1/4. The correct answer is option. The denominators are already the same, so add the numerators, 3 plus 1 equals 4, then simplify to 1/2. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 2. During a quick next review of a mean score item, which word is closest in meaning to deficient in a study guide note? Option A, lacking. Option B, peaceful. Option C, bright. Option D, complete. The correct answer is option. Deficient means lacking, so that choice matches the meaning in context. Peaceful means calm, not lacking. Bright means full of light, not lacking. And complete means whole, not lacking. Question 3. After checking the choices in a probability set item, which answer identifies the substance dissolved in a solution? Option A, catalyst. Option B, solvent. Option C, solute. Option D, precipitate. The correct answer is option. The solute is the material being dissolved. Catalyst speeds a reaction, solvent does the dissolving, and precipitate is a solid that forms in solution. Question 4. If a test strategy stem gives one clear clue, which answer best explains the author's point? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed sets remove all content gaps. Option B, the exam has no time pressure. Option C, timed practice can build exam familiarity. Option D, comfort never changes with practice. The correct answer is option. The passage connects timed practice with increased comfort. Timed sets remove all content gaps is not supported by the passage, the exam has no time pressure is not supported by the passage, and comfort never changes with practice is not supported by the passage. Question 5. When time is limited on a main idea question, which critical thinking response best fits this situation? A patient says, I feel better, so I stopped the medication early, in a health literacy passage. Option A, teaching is unrelated to medication use. Option B, the statement shows a need for clearer teaching about completing treatment. Option C, medication should always be stopped early. Option D, the patient fully understood the instructions. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Teaching is unrelated to medication use does not follow from the situation. Medication should always be stopped early does not follow from the situation, and the patient fully understood the instructions does not follow from the situation. Question 6. Given the information in an inference clue item, which dose volume gives 75 mg from a supply of 150 mg per 2 ml? Option A, 1 ml, 1. Option B, 2 ml. Option C, a 0.5 ml. Option D, 1 ml. The correct answer is option. Set up the proportion 150 mg, 2 ml equals 75 mg x ml, so x equals 75 times 2, divided by 150 equals 1 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 7. Suppose a similar author purpose item appears on test day. Which word is closest in meaning to efficient in a study guide note? Option A, narrow. Option B, productive. Option C, ancient. Option D, wasteful. The correct answer is option. Efficient means productive, so that choice matches the meaning in context. Narrow means not wide, not productive. Ancient means old, not productive. And wasteful means using resources poorly, not productive. Question 8. While working through a timed summary task set, which answer identifies the transfer of heat through direct contact? Option A, irradiation. Option B, convection. Option C, conduction. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 9. Before choosing an answer in a sentence correction item, Which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A. Headings reduce the value of information. Option B. Pictures make written instructions unnecessary. Option C. Clear formatting helps readers understand health information. Option D. Long paragraphs are best for patient teaching. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information, is not supported by the passage. Pictures make written instructions unnecessary, is not supported by the passage, and long paragraphs are best for patient teaching, is not supported by the passage. Question 10. A student sees this punctuation review idea on an X review, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 44. Option B, 8. Option C, 26. Option D, 5. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. One pronoun agreement practice problem tests the skill, which average results from scores of 75, 79, and 83. Option A, 79. Option B, 237. Option C, 77. Option D, 8. The correct answer is option. Add the 3 scores to get 237, then divide by 3 to get 79. The other choices use the sum, the range, only 2 scores, or an added value rather than the mean. Question 12. Several choices look tempting in a parallel structure item. Which word is closest in meaning to expand in a study guide note? Option A, shrink. Option B, accept. Option C, increase. Option D, whisper. The correct answer is option. Expand means increase, so that choice matches the meaning in context. Shrink means become smaller, not increase. Accept means receive, not increase. And whisper means speak softly, not increase. Question 13. For this active voice nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, estimation. Option B, bias. Option C, classification. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Estimation is an approximate calculation, bias is a systematic error, and classification is grouping items. Question 14. In a short capitalization check practice STEM, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, volunteer programs grow without communication. Option B, former patients stopped the program. Option C, orientation should never include stories. Option D, personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Former patients stopped the program is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 15. Among the choices in a clinical scenario item, which answer identifies the group that does not receive the experimental treatment? Option A, sample. Option B, a control group. Option C, experimental group. Option D, a conclusion. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied, experimental group receives the treatment, and conclusion is the final interpretation. Question 16. Using the facts in a community clinic question, which for flow rate delivers 1.2 L over 4 hours using a 15 GTT/ml set? Option A, 75 GTT/min. Option B, 5 GTT/min. Option C, 4,500 GTT/min. Option D, 300 GTT/min. The correct answer is option. Convert 1.2 L to 1,200 ml, then use 1,200 times 15 divided by 4 times 60 to get about 75 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 17. Based on the clue in a student survey item, which word is closest in meaning to infer in a study guide note? Option A, whisper. Option B, copy. Option C, erase. Option D, conclude. The correct answer is option. Infer means conclude, so that choice matches the meaning in context. Whisper means speak softly, not conclude. Copy means duplicate, not conclude. And erase means remove, not conclude. Question 18. Consider this high-yield wellness app concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, a trachea. Option B, artery. Option C, a vein. Option D, capillary. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, artery moves blood away from the heart, and vein returns blood to the heart. Question 19. Near the end of a practice timer review session, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, quiet rooms increase noise. Option B, the distractions are always helpful. Option C, reducing distractions can improve study conditions. Option D, students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Quiet rooms increase noise is not supported by the passage, distractions are always helpful is not supported by the passage, and students no longer needed to study is not supported by the passage. Question 20. Across similar exam readiness nursing entrance questions, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. The conclusion may be too strong because another factor could explain the scores. Option B. The conclusion should ignore group differences. Option C. Random assignment is never useful. Option D. Higher scores prove every student studied more. The correct answer is option. Without random assignment, group differences may affect the result. The conclusion should ignore group differences does not follow from the situation, random assignment is never useful does not follow from the situation, and higher scores prove every student studied more does not follow from the situation. Question 21. Since only one choice fits the quick review clue, which value of x solves 6x plus 12 equals 78? Option A, 66. Option B, 12. Option C, 11. Option D, 10. The correct answer is option. Subtract 12 from both sides to get 6x equals 66, then divide by 6 to find x equals 11. The other choices result from stopping after subtraction, adding one too many, or not reversing the operations in the equation. Question 22. From the information in a hard question item, which word is closest in meaning to obtain in a study guide note? Option A, to deny. Option B, get. Option C, melt. Option D, lose. The correct answer is option. Obtain means get, so that choice matches the meaning in context. Deny means refuse, not get. Melt means turn liquid, not get. And lose means no longer have, not get. Question 23. At a testing desk during a easy question review, which answer identifies the organ that produces bile? Option A, gallbladder. Option B, pancreas. Option C, liver. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, pancreas secretes enzymes and hormones, and kidney filters blood. Question 24. Inside a mock test science or skills item, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, the refresher removed all risk permanently. Option C, a training may have improved compliance with hygiene practices. Option D, a training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection is not supported by the passage, the refresher removed all risk permanently is not supported by the passage, and training increased infection rates is not supported by the passage. Question 25. Through careful reading of a diagnostic set stem, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 44. Option B 7. Option C 10. Option D 27. The correct answer is option. The increase is the final value minus the starting value, 2717 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.